Joining me now is Representative Travis Couture, a Republican from the 35th Legislative District, who is a fierce critic of the Keeping Families Together Act. Travis, thanks for joining us. You have proposed legislation to allow the state to remove kids when drugs are being used in the house. So what's the biggest challenge you faced in the so-called dead baby bill in getting it passed?
Yeah, thanks for having me on. And I think one of the biggest challenges to fixing the Keeping Families Together Act, which has led to a tragic amount, a record amount of deaths of babies and toddlers in our state, is just simply getting lawmakers to clearly see the data. And then understand that we shouldn't have sacred cows as far as legislation or laws in our child welfare system, especially when it's leading to exponential amounts of child deaths all across our state. I think it's going to take some bipartisan work to really work on the middle ground solution as far as removing kids for their safety and also getting those parents who are substance addicted the help that they need so that they can one day reunite with their kids.
So roughly, how many deaths are we talking about in total since 2023?
2023, we had a large amount of deaths, and then it increased in 2024. And we're starting to get the evidence, the critical data for the first quarter of 2025. And just between the first quarter of 2024 and the first quarter of 2025, there was a 200% increase in critical incidents involving child welfare, and 54% of those were involving opioids like fentanyl. The drugs are a lot more dangerous, and it's absolutely, especially after the enactment of the Keeping Families Together Act, is leading to the deaths of a lot of kids in our state. And oftentimes it's babies and toddlers under 3 years old. That equates for almost 180% increase between those two quarters itself, because they're going around and exploring the world and putting things in their mouth. And when parents who are addicted to drugs are leaving fentanyl or other things laying around, those babies and toddlers are sticking things in their nose and their ears and their mouth like they would normally at that age of development. And so it's leading to a lot of overdoses and near deaths, but tragically a lot of deaths as well. We're looking at in the first quarter of 2025, a record amount, upwards of over 25, almost 27 different critical incidents.
It is horrific. I understand for Democrats this is an equity issue, but why are they so dug in and refusing to declare fentanyl dangerous when we see it killing people daily, as you just pointed out?
Yeah, it's killing people daily, and a lot of the times what people see is the slow motion death on our streets. We see the tragic outcomes of fentanyl and meth and other things, trank, that's happening, that's playing out in our streets. But what we don't always see is what's happening behind closed doors with some of our families. And that is also a tragic number, and it's totally preventable. One of the problems I have is that when you look at a fatality report, you see a blacked out line over the child's name to protect their identity. But oftentimes, policymakers, I feel, look at that black line and just think it's another government statistic. But behind that is just the crushed dreams of a child that, could have had a second chance at life. And foster care is not perfect, but it's preferable than being dead. We have to do a lot more. And I worked on House Bill 1092, which is my bill to be able to remove these kids. And one of the problems with the Keeping Families Together Act is this barrier of imminent harm as a standard to be able to remove kids. Well, that's an impossible standard. It basically says that social workers, law enforcement, pediatricians, whoever it may be, have to essentially have a crystal ball to predict when a child might die in the courtroom. That's an impossible, barrier to overcome. And when I worked on House Bill 1092, I did so with social workers who have dramatically high caseloads right now and are watching a lot of these babies die under their care, and there's nothing they can do about it in the courtroom. They feel like they don't have the support from their agency agency, the Department of Children, Youth, and Families, pediatricians who see abuse and neglect and can do a lot to try to help, and law enforcement as well are seeing these things, and the law has tied their hands. And it was already getting bad before Keeping Families Together Act. But as far as it relates to an equity issue, one of the kind of core premises behind the Keeping Families Together Act is that we didn't want to disproportionately remove minority children from minority parents. But now the law has created this catch-22 where instead of removing minority children disproportionately, the state is allowing minority children to die disproportionately under the supervision of the state in the homes of parents who are abusing hard drugs like meth and fentanyl. Often the two are laced together. It's a tragic thing, and you could look back at many cases like Oakley Carlson or Ariel Garcia, or many of the cases that your station has even covered in the last couple of years. And of course, you can't prevent every bad thing from happening, but can we just try? Can we just try to save some of these kids? It sickens me. It's a needless amount of death, especially as you look over across the state in the Spokane area is absolutely getting hammered with fentanyl right now. And nothing seems to be being done about it, except for, some lawmakers are clutching their pearls onto the sacred cow of the Keeping Families Together Act over equity while allowing kids to die. And that is wrong. We have to be able to, yes, respect parents' rights, but when there is abuse and neglect, the state must step in, and keeping your fentanyl around for your toddler to get into is absolute neglect. If you can't care for, nurture, feed, bathe a child, then that's a neglectful situation, especially if, as the parent who is addicted to hard drugs like fentanyl, they can't even do that for themselves. So what I have proposed, and it's a bipartisan proposal that is starting to gain some steam, and I hope passes in the future session, is that we should be able to remove a child for their safety and then try to get the parents help so they can get clean and sober and one day reunite with their kids again. But also we should stop these crazy policies like allowing kids to remain in fentanyl-filled homes because the state provided a lockbox in order for the drug-abusing parent to store their illegal narcotics in. That is absolutely the wrong direction. And I'm not proposing that we go back to the 1980s war on drugs, but we have to have balance in our public policy and balance in our state in order to protect the rights of parents, but also to protect the lives of kids. They're not just a black line. They're not just a government statistic. They deserve a second chance at life, and we need to stop being crazy about this.
I can't think of a more important issue. Representative Travis Couture, thank you for bringing it to our attention and continuing to fight the good fight to bring awareness to this issue. It's complicated, but something has to be done. Thank you for joining us.
Thank you.